Hello, hello. Welcome to the AKF channel. My name is John Michael, and today we are interviewing two very special guests today, two psychologists, Dr. Fox, Dr. Chandler, of the Georgia Autism Center. We have some very helpful tips that they're going to give us today. So, without further ado, let's jump into the legal sauce of it. So, first question. So, what are the early signs or symptoms of ASD that parents should be aware of?
So I think it's important for parents to recognize that symptoms can vary based upon age. Some symptoms may be seen as early as the first few months of life. Some symptoms may not be readily apparent until a child is closer to ages 2 or 3. Some children even don't really start to show signs until they're closer to ages 4 and 6, as those social expectations become more complicated and more complex for children. It's also important to remember that not all children are going to show all signs and symptoms of autism. Some kids that do not have autism may show a few of these signs. So by 6 months, we're really kind of looking to see, are they smiling? Do they show kind of warm, joyful, engaging expressions? What is their eye contact like? Do we have limited or no eye contact at all? When we're getting closer to 9 months, we're looking to see, are there any back and forth sharing of sounds, smiles, facial expressions? When we hit 12 months, we start to look for things like, are we using first words? Are we babbling? Are we using any gestures like pointing, waving, communicative reaching, those sorts of things? How is their response to their name? Are they able to respond to their name when it's being called by their caregivers? When we get closer to 16 months, we start to get more concerned if there has not been any first word usage at all by that age. And then when we hit 24 months, we're really looking to see, have they started to use these 2-word phrases? Are they able to use them in a meaningful way, or are they just kind of saying words without them being related to the context of which they're being used? And it's important to remember that at any kind of age, we're also looking to see, do they have any repetitive motor movements that we're looking for? Those are things like spinning, rocking, hand flapping, finger flicking. They're also looking to see, do they have sensory interest that are unusual, either aversions or sensory seeking behaviors. Some of those things could be prolonged visual inspections of objects or themselves or lights. They could be, looking at objects really close to their face or looking out the corner of their eye at things. So we're kind of also looking at their sensory experiences as well. Are they having aversions to touch, taste, smells, all those sorts of things?
Excellent. So how do you determine where a child falls on the spectrum? This mild, moderate, severe, etc.?
So we basically look at how these symptoms are impacting a child's ability to kind of go through daily life and be able to function, and what level of support do they need in order to be able to function on a daily basis. And we use the DSM-5 diagnostic criteria to kind of help guide us in whether a child falls mild, moderate, or severe. So we have, 3 different levels. Level 1 would be mild, level 2 would be moderate, and level 3 would be severe. Level 1 is going to be more a child that needs some support, whereas a child that might be level 2 is going to need more substantial support, and a child that would be level 3 is going to need very substantial support. So we're looking to see, how are they using their language, how do they use their social interactions, and to what degree are some of these restricted, repetitive behaviors potentially interfering with their ability to function.
What are the common comorbid diagnoses seen with autism spectrum disorder?
So oftentimes we tend to see other neurodevelopmental disorders that come along with autism. So those are things like attention hyperactivity deficit disorder, or commonly known as ADHD. We also tend to see intellectual disabilities, as well as possible learning disabilities. A lot of the children that we see on the autism spectrum oftentimes have language impairments as well. Some of the other kind of psychiatric disorders can be things like anxiety, depression. We can also see things like tics or Tourette's disorder that's commonplace. We also tend to see a lot of other like genetic and medical conditions as well. So lots of the kids that we see will have feeding, GI, elimination issues, lots of issues with sleep, things like epilepsy. We tend to see genetic stuff that comes into play as well, like Down syndrome, Fragile X syndrome. We also tend to see a lot of gene duplications and microdeletions and that sort of stuff as well.
What are some of the specific diagnostic tools that are used during the assessment process? For instance, what is the ideal evaluation process for the most accurate diagnosis? Who are the professionals qualified to provide a diagnosis of ASD? Those sorts of things.
So assessment boundaries really kind of depend upon the age of the child and what the particular reason for that evaluation may be, as well as kind of insurance also kind of dictates sometimes what types of diagnostic tools we may need to use for an individual evaluation. So some of the things that oftentimes parents come in looking for evaluations is so that they can get access to treatment services for things like ABA therapy. Sometimes it's in order for their children to be able to get some sort of school accommodations and or placement in particular schools for more support. So we oftentimes will be, doing these evaluations to help get, IEPs established. We're also, sometimes parents are coming in for pursuit of like Social Security benefits, or we also have something called a Katie Beckett DME waiver that parents can use to help get additional funding to use for services that their children may need in order to help support their development. So oftentimes most batteries are going to include some sort of adaptive functioning and or developmental measure so that we can kind of see how this child is developing, where their strengths and weaknesses are, what challenges are they having in their daily living skills. We're also going to be, of course, completing lots of autism rating forms. Those oftentimes are completed by parents, sometimes with teachers, depending upon the child's age, if they're in preschool, at a daycare facility, those sorts of things. And sometimes we may do an interview with the parents as well, depending upon the child's age. And we always will include a play and social communication assessment. And so that is the ADOS, and it's kind of the gold standard that we use in the field to be able to assess what a child's play skills are, what their social interaction skills are. We're also looking at their language usage. Are there any, sensory concerns going on? Are there any of those restricted repetitive behaviors taking place? Some of those batteries can include measures to look at other areas of concern. So as we mentioned before, there can be other comorbid diagnoses that come along with autism. So we may look at things for, their academic skills, what their cognition is, their language abilities. Are there any executive functioning deficits that may be above and beyond what we would expect to see for a child that has autism? And as well as some emotional behavioral ratings sometimes too. A lot of children that we see will oftentimes have comorbid emotional difficulties and or behavioral challenges, and so sometimes those are helpful to kind of see where we're standing with that as well. And in terms of professionals that can help diagnose autism, of course, child psychologist, child psychiatrist, developmental pediatricians, and pediatric neurologists are kind of the big professionals, I would say, that are probably the most qualified to be able to provide that diagnosis.
So, how frequent is the child seen by his or her psychologist after the initial diagnosis is given?
Is that mine?
Mm-hmm.
Oh, okay. It depends on the age. Typically with the younger kiddos, when they come in and they get their initial diagnosis, we like to see them back within a year. It may be sooner than that, depending on the needs of the family. So we also do reevaluations with children to assist with IEP placement and then also obtaining additional services. So we may end up doing another evaluation a year after they were initially diagnosed or a couple of years after they were diagnosed. We do recommend to the families to at least bring their child back once a year so that we can follow them. And the reason for that is to make sure that their treatments are effective, that they're happy with how everything is going, and that they're making progress.
Can a child grow out of their diagnosis or no longer meet criteria after intensive interventions?
So this question actually has come up more recently in the psychological community. I would say 10 years ago, the answer probably by most psychologists would say not likely, no. But I'm going to say that the perception of that has changed in the last probably 4 or 5 years since Ava's Law was passed. And Ava's Law has allowed for children to receive intensive ABA because a lot of insurances now are covering it. So children were going from receiving 1 hour of OT or speech a week to now getting 30 to 40 hours of intensive ABA. So the question of whether or not kids can actually grow out of a diagnosis, it depends. I believe that there is a possibility that a child could no longer meet criteria for ASD. That may be with a kiddo who was diagnosed early on at age 2, and what we were seeing is very mild ASD, and the child then went on to receive intensive interventions. We did another evaluation, say maybe 3 or 4 years later, or maybe even longer, and the disorder is no longer causing clinically significant impairment in that child's life. So at that point, they may no longer meet. I do tell parents, because parents often will ask that question, that it's unlikely that all of the symptoms would resolve and that the child may need some supports as they go throughout life and transition into adulthood. We all do at some point. But in terms of diagnosis, that they could climb out of it.
And I think just to add a little bit onto that too, it's important to remember too that symptoms can oftentimes wax and wane like over the lifespan. So it really kind of depends upon the things that they're exposed to as they continue to develop and grow too. You know, life stressors, changes of environments, as well as, you know, suffering any sort of traumatic events. Those sorts of things can also cause those symptoms to increase or decrease over time too. So I think that's important for families to recognize.
Right. And I've never had a family to actually come back and ask me at this point to do a reevaluation to see if their child is still meeting criteria for ASD. And the reason for that is once families get their child set up with the therapies and they're receiving all these supports in the school system and their child is thriving, parents like to see that. They like that their child is making progress. And then at that point, what I do see is sometimes families are afraid to let go of those therapies and they want them to continue. So oftentimes at some point they want their child to continue services, so I don't really see them coming back asking for an evaluation to remove the diagnosis. I do believe we may be seeing more of that though in the future.
How do you approach situations with parents who seem anxious or hesitant about having their child diagnosed with autism spectrum disorder?
That's another thing that I think we do see a good bit. That's one of the challenges that I would say I face as a psychologist in helping parents in that sort of situation. I don't make decisions for parents. This is a decision that they have to make, but I try to approach it with being very supportive, very understanding, empathic. I help them to understand the advantages and, you know, if there are any disadvantages of being evaluated and obtaining a diagnosis. And then we talk about, you know, what that would look like. And so I sort of walk them through the process and help them to decide whether or not this is a good time for their child to be evaluated. There are times if a child comes in and they're showing really just mild signs of ASD and it's not really causing clinically significant impairment, or maybe right now they just need speech or OT, I might have a conversation with the parents about let's holding off on getting an evaluation at this point because I don't think something like ABA is what they need, and then revisiting it in 6 months just to give that time, the child a little bit more time to develop, and also just to give the parents a little bit more time to process what's going on.
What are your thoughts about parents who have children who have been diagnosed with autism who would like to perhaps themselves get evaluated as they see similar symptoms within themselves? Would you say that there's an advantage or disadvantage to this desire? You know, for instance, would there be any advantages or disadvantages for their child if they did that?
Yeah, that comes up. Oftentimes parents, as they're going through the process, will say that they're seeing signs in themselves that they are learning about in their child and that they would like an evaluation. And so I think also we're very supportive of that. I don't see any major disadvantages to something like that. I think it would be good for the child, depending on their age, if they understand what's going on, to see their child, their parent go through a similar process. I think it also allows the parent to be more empathic about what's going on with their child and the process that they're going through. So I think it's fine to do that. I think also we don't really understand what's happening in the family dynamics, and sometimes if the parent also has autism, it may be causing some problems in the family dynamics in their marriage, and if we can assist with that to help the spouse understand what's going on with their spouse, then I think that would also be beneficial, and then we provide additional resources for them.
Fabulous. Well, thank you both so much for joining us today. Great helpful tips today, and it was a privilege to have you.
Thank you for giving us this opportunity.
I hope this was helpful.
Well, that's all the time we have for at the AKF channel today. We'll be sure to join us next time with some new guests next week.